partners to feel threatened that you are now taking over the program. But through a very defined role, you should be able to present your work, and probably also, you need also to do your homework. Before you get onto the table, you need to know the priorities of the government. Does your scope of work align with the priorities of the government? That already gives you an upper advantage when you engage with these policymakers. Then you need to specifically set the agenda and the objectives. You can't be everywhere. You can't be TB, you need to have a specialty, even in the medicine. So I'm trying to cut on a lot of talks because I was cautioned and organized on how to be specific. Secondly, we are looking at strategies. One of the things, lessons learned from different countries that we are discussing, is that some countries have actually created what we call a CSO desk at the parliamentary level. So they have the highest representation. For us, this is a good strategy where whenever decisions are being passed, we have a representation there. So we can see how we can maneuver around in making sure that we have this representation there. Establishment, for example, for the TB, we have the TB caucus. The malaria also has something like that, and malaria council, which is at this level. So representation at parliamentary level, it makes us part and parcel of the decision making. Then issues now within the systems, government systems. We have the issue of creation of local or focal point persons or champions. This can run now, for example, in the TB program, we have the national, let's have someone that you can easily link up with at national level. And this can only be done through engagement with the government bodies so that they create that system. Zambia already has this, and I know other countries should have some systems like that. But others that are still in the process of creating, I think it's one of the ways in making our work easier. Lastly, on the strategies, don't start operating without a clearance of any sort. They need to have MOUs. Introduce yourself to the relevant ministry that you want to work with so that they know you. This becomes a binding document that can help us actually to do more work in our particular areas. Lessons learned. Definitely, this cannot be overemphasized. Friendly collaboration that lead to sustainable partnership. The way you come in is the way you will be flipped out. If you come in with force, you also be flipped out with force. But friendly always wins. No one wants to resist something that comes in a good way and that wants to help you. Again, we re-emphasize what you talked about in the morning. Evidence, evidence. Evidence strengthens advocacy at any level. Even if someone is saying, once you present the true evidence, they'll definitely bend to your needs. CSO is a lesson that I think I mentioned. Desk promotes inclusivity of stakeholders. That is our CSO being part and parcel of the discussion. What advocacy message are we going to put across? Having said all that has been said, so we will say there is need to appoint. If you haven't appointed, establish. If you haven't established, or you have established, please, there is need to strengthen CSO's focal point person at every level of government structure for us to have a true representative at any time. So this, for me, is a key thing that we can pick. Once you have someone that the CSOs can easily link up with, who understands the dynamics that the ministry is dealing with, it will be easier for us to operate as civil society organization. And definitely, all this requires money. So issues of, even as we leave this, we can forget everything. But the issue is here on domestic resource. We are in a place where we don't have resources, and resources are dwindling. Therefore, we need any opportunity we have to have that advocacy for resource. Thank you so much.
Dr. Mbanga, you have to come.
Oh, I need to come?
People have questions.
You don't want questions, but additions.
Additions.
Yes. Additions.
Maybe something around sustainability. People, an action point around sustainability will help. Because, like they're saying, allocate
Sufficient domestic resource.
How? You know, how are you going to go around that one?
Wonderful. So, you remember this?
Don't tell it.
Please don't tell me.
Don't tell it.
You remember these guys that we are talking about here?
Yeah.
All the decisions around money are made there at parliamentary level before you even do anything. So a voice added at every level, especially at parliamentary level, will be a game changer. For me, this is very clear, and every time I find an opportunity of having an opportunity of meeting with people, I say, please, let's place ourselves strategically here. money will get it. For me, this is the game changer here for money.
Let me add to that point. And even if you have the committee chairperson who has some passion for TV or your program, it does help.
Yeah.
If you look at the NTP director who was here yesterday, he's a new person. So yesterday, the parliamentary select committee chairperson had a discussion with him. There's money locked up somewhere. That parliament is aware. But he, as a new person, still hasn't averted his mind to that place. So the chair was telling him that this is where you can get your money for projects, your advocacy, other things. I even took him through how the ways and means, where to get to, who to touch to get those monies. So that's a very good point there, because you need somebody, either a rep there or somebody who has the heart of civil society in there. Yeah.
That's a very good point.
Yeah. And there was something that was going to say the governments are always changing.
Yeah.
But once we have a system that sits permanently there, it becomes a key point where we can hammer every time. I think we can end here for now. I'm pretty sure we can end here for now.
Thank you. Thank you, Dr. Mubanda. Team
Thank you.
1.
Team 1. Bradley. Hello.
Mohammed, Paul, myself, Stephen, and Lionel. By the way, Lionel is my last son.
Oh, wow.
Very smart people up here. So our question was strengthening and sustaining community engagement in PHC, PPR, and TV governance. And we had 2 issues that we're looking at: what approaches have proven effective, and how we can institutionalize within the health governance, of course, with the advocacy messages that we have developed. So we looked at the lessons learned, and one of the lessons that we've learned is that the slide is not moving.
It's not on slideshow.
Yeah, it was not sure.
Just click on it.
Down. Yeah.
Just taking us to the, you need to look for it somewhere. Anyway, you can take it back to,
That's the reason you don't use.
yeah, just click on the slide.
Just click on the next
There
slide.
was too much
Yeah.
Click on the
technology
next slide,
after
the next one.
Just one.
No, the next one.
Yes.
That's one.
So yeah, that there is need for advocacy around policy legislation, and when that happens, it works. We need to be able to have any alignments with the community engagement proposals, as well as any reforms that are needed. Capacity building is key, because empowerment of communities is important for their meaningful engagement. Participatory platforms are important for communities to be able to engage. So we need to be able to identify these platforms to ensure that there is representation of communities, and we give examples there. For example, the country coordinating mechanisms, community committees, including community health committees, or even PPR committees, health management committees, PPR TWGs, even at the national level, and including the lower levels of community dialogues through the community units and many others. Sustainable funding mechanisms are important to consider, such that in the event that the donor does not provide facilities for community engagement, then there should be a way of the government working with the communities to ensure there is a sustainable funding mechanism and budgets allocated for community engagement. Community accountability tools, very, very important. The platforms to be able to conduct community-led monitoring, to be able to just conduct the day-to-day monitoring and accountability. It could even be through scorecards and tools like that. Because we realize that M&E for communities is also very key. We have been saying from yesterday that data is key. We have to be able to provide the evidence even as we push our agenda forward. Last but not least, we have the inclusive governance. And here also we are looking at ensuring that we have rights-based inclusivity in all our various platforms, and even in planning, implementation of our project activities, to make sure that the populations that are vulnerable are also taken into consideration, and that their voices are heard in the spaces. So for our advocacy messages, next slide. We have statements here that community engagement is not optional. It is very essential in all stages of government or in all stages of governance. Actually, that one should have been governance. Community empowerment starts with policy reforms. If you are to empower communities, you need to be able to build their capacity, but at the same time give them opportunities to be able to participate in the governance. Investing in community is investing in resilience. This is a word that we have highly interacted with in GC6, GC7, and even moving forward to GC8. We want to see it moving from words to action, especially where communities have been embedded into the processes of building resilience. And pandemics affect individuals before they affect the health system. So it is important that we invest in communities so that they understand, even as the events and incidences happen, that they can help mitigate the spread of those pandemics, and therefore very, very important for them to be engaged in the onset. Integrating TB services at all PHC levels will help reduce mortalities because there will be early diagnosis and reduce and it's cost effective, and therefore we will reduce catastrophic costs. We had the costs, and I was shocked that in Liberia, is it Liberia, where somebody was moving with $50 to one place and moving back with $50. That's a very, very high cost for transportation, and you have not also looked at other costs that come with that. And therefore, that integration is very important, not integration by paper, but integration through provision of diagnostics and provision of even training for the respective healthcare workers who serve in those facilities. And for our slogan, nothing for us without us. We are the experts. We know best how to address the challenges that face us. Thank you.
Beautiful one. Beautiful. Comments?
When something is good.
Team 2. Yeah, next. Team 2. Geraldine. Let me help you.
And also for gender, health equity, gender and rights in TB, what barrier persists for women and marginalized group. So we look at it at 3 different levels. We are saying at the strategic levels, when we talk about policy makers, maybe lawmakers, we say barriers that exist are less women or marginalized group representation. If you look in our parliaments, you'll see that there are less women represented. You'll see that people with disability, you haven't found them there. So at this level, those are barriers that are there. And you also notice that because of this and less representation, you don't find decision in favor of people like that. And then we go at the program level, we are saying that because these people are not represented at the policy or at the law level, decisions that are made here also affect programs. So our documents, our policy, all speak to the issues that are being discussed at our levels. And we also have lack of specific program protocols that capture different vulnerable groups like women, people with disabilities. Then we come to the program level. We continue with the program level. We also say that whenever we are developing our program material, policy to do certain things and are prevented to doing certain things, even economic barriers where women have less power when it comes to money. Women are now usually mostly financially capable to do certain things. So these barriers also affect them. Also, decisions in homes at the community level, most of the decisions are made by the men. So these are barriers that affect women. So after listing those barriers, we come up with the advocacy. What are those things that we can do? We are advocating that at the strategic level, we want to encourage women to take on more key roles. Like for example, in my country right now, we have the president pro tem is a woman, and we have the minister of health is a woman. We also have, so those key positions, not just 2 or 3 women in the house. We are saying at least we have a percentage that is advocating the 80-20 like that. So if we have 8 men, we should be having like, 2 women or 4 like that. So these are things that we are advocating for, that women should take on more roles within the house in the policy level. And we also work on many engagement, the policy, the parliament and media for discussion on the reduction of stigma of certain groups. Those things at the level of the parliament. At the program level, we want to advocate for inclusion of people with disabilities and program to ensure that they are included in all of our documents, make sure that policy consider them, make sure that they are considered for even taking on key roles. We should not only look at, okay, this person is a man, or this person is a woman, or this person, but everyone should be, it should be inclusive. So then we should advocate for materials. When we are developing our ICBCC materials, it should no more be like, so one size fit all. We should segment our audience. If these people are people that have to do with hearing loss, we should face messages with sign languages, use braille to develop messages to have our people, the marginalized group, consider women. Also, there are things that women, that affect women, we should also consider them. Then, at the community level, we also want to have town hall meetings where we bring together the fathers, the chiefs, the leaders, to tell them the barriers that women are facing when it comes to issues for TB or marginalized group. How can the community see that the cultural barriers, those things that are affecting women, we want to ensure that we discuss it in the community at the community level. I think we left on one of our presentation was 2. And also empowering communities, like we said, don't do something without us, right? The slogan. We want to empower communities after the meetings, and then systems that are already in place. We have local structures, we have the chiefs. This system, we are saying when you are discussing issues at the level, please include women, please include marginalized groups. So those empowerment, considering them. And at the community level, we also want to empower women, right? If women are not empowered, they cannot take on key roles. So we are saying that let us give them some small handout to start a business. Like for someone who is in a chair, who is having some disability, who cannot hear. Like for example, my colleague said in Nigeria, maybe just give me a person or 2 quotes and say start this business. This woman, so as long as she economic power, she cannot take on all her role making decisions. So we are saying that fathers, please let work with us, chiefs, let work with us, and ensure that we empower people that need to be empowered at the community level. So those are points that we came up with. Maybe I left out something I would like.
Where's it now?
I love that class of my group. Yes. So it was crazy. We took a flip chart that already has so many things written. So okay, this is something that was amazing. Yeah, so we have empower women and all marginalized groups on small and medium scale enterprise to empower them. Ensure that community level structure such, make sure that this is sustainable. Let us integrate it into our system. Whenever we are discussing issues, you should consider everyone because we are one. Thank you so much. I can see the hand clap. Continue.
Any comments? I think the 2 is very good.
Yeah.
Yes. So that was good presentation from all the groups, and I think I'll just give people a chance just to summarize all that we've learned within these 2 days. So from day 1 and day 2, what are some of the learnings you've done today? I'll just hope to anyone to share some of the learnings you've done today.
Today, from yesterday or today?
Within the 2 days.
Today, 2 days. I have to say, because COPA is not in Ghana, it's sort of a whole new eye-opener for me in terms of how I think there are other countries are really preparing, as you say, for pandemics and how they will respond. And it's giving me a kind of something to chew on to see what we are doing as a country, one, and what we at the CSO level we can also do. For TV Voice Network, we always want to see opportunities in this space. So my first thought is like, what is the opportunity in this 4 hours sort of? But like I said this morning, first you have to know what is there, what is possible, what has been done, and then you can then try and do what hasn't been done. So that is on the COPA. And I also see a lot of activism on the part of CSOs across Africa, which I'm glad, because it seems that the momentum is kind of helping the global fund and all the donor community to rethink their approach to how they see communities. And as I think the program manager from Nigeria said, basic that prevention starts at the community. That's the one I've just put in my head. The rest I don't want to add, but the prevention will start at the community. So I think it's similar to what TV we say, put us at the center of the internet. But at the same thing, the role that communities play is undervalued, I think, for a long time. But I think that now there's light, there's resurgence among us. And we are learning how to gather the data and the evidence to support the work that we are doing, put value on our work, so that increasingly I'm thinking that we will also make the Global Fund proud in GC8 in terms of whatever we've learned along this thought process to make impact in the next plan cycle. So I think I'm happy. We can do more of this. I think it helps us to. They say that you think when you are in your space, you think you are doing a lot until you see what others are doing, and you say that, oh, okay. And then there's more that can be done, So I can say this whole section about COPA. I think somebody else said with the SSC partners, I've been seeing this webinar coming up all the time. I'm like, what is this COPA thing? I'm always yeah, I know, right? But now I think I have interest. So the webinars, for example.
Unfortunately, we have our last webinar. I think 40. I'll share.
Okay. So,
the last webinar.
but at least this workshop or the learning has opened my eyes on a lot of things that we do then, and of course we consult you for more.
Thank you so much,
Congo, RDC, and Guinea-Conakry. So I have learned many things about, I think it's Zambia and the true other country, and I will capture all of this best practice because I'm the I'm the referent of the CC initiative in this country in my organization. So the comment of the previous intervenant said that give me one idea. I think in the CC initiative we are not just three. We are also our colleague, and we can also organize this type of initiative like COPA webinar, who can be a great platform to share best practice, case studies, and other other many things. So let's mind about it, change the world. So thank you.
Receive promise to get your information for you.
Yeah.
That's true. That's true.
Project. And one thing that I'm going to take home is TB needs to have the multi-sectorial approach. We should not let it only be the Ministry of Health issue. We need to see other sectors such as infrastructure development come in. We need to see sectors like the private sector come on board, because in the previous years, or even up to now, people in the community will still feel TB is a responsibility of the Ministry of Health because it's a disease. But when you look at how it is spread, overcrowding, Dr. Manga talked about the tobacco aspect. So how are other countries managing that? Because in our country, there's a huge advocacy around tobacco control, because we have seen so much of TB cases. So how can we bring such stakeholders on the table to say, see, your products are causing this problem in our society. How can you come on board and fight this cause? Because time and again, we can have all these different initiatives, but if it does not have that multi-sectorial approach, it becomes the work done is equal to zero. So from this workshop, it has really enlightened me to see even how, if we go back as civil society or as communities, how can we even engage these partners to bring them on the table? Sometimes the solution will lie with them through their contribution towards this, because they feel maybe they've been left out. It's a responsibility for the government, but forgetting that they've got a huge role to play as well. So engaging them is what I feel can also be a game changer. Thank you.
Thank you very much. Meeting is coming to an end. And for me, I feel like I've already established personal relationship with everybody. I can tell you confidently that I know everybody's name here. Your first name and your surname, because I had to do your ticketing and everything. You can imagine the number of times I was booking your flight, so you can imagine I need to memorize everything and ensure that everything is on point. Yes, for Balogan. Mohammed Samura. Yes. So you see, I know everybody's first name and your surname here, and I'm happy that you made it here. You made it here to eat one of the best jollofs in Africa. I'm happy that I'm happy that this meeting has been very successful. I am glad I met all of you, and I pray that we continue to not just work together, but build that relationship. It's not, work is one thing, but the other aspect too is the continuous engagement. You can send me an email anytime, and I'm very responsive. Like when you send a message and I'm not responding, then maybe it's because I don't have the answers. But once I have the answer, I respond to emails like immediately. Or when you send me WhatsApp, I respond immediately. If you know me, even at home, I do those things. So thank you very much, and I'll call on Imoro to do the closing remarks.
Oh, my dear sister, I'm very done. We've been up and doing for 2 good days. And I must say, on behalf of our executive chairman, Chief Austin Alenzi Obiefuna, and on behalf of Rachel here, my working partner, and also on behalf of all the Act Africa staff members, we want to express our heartfelt gratitude to you for making time to come from your respective countries to join us here in Ghana for these shared experiences. It's been a learning curve for all of us. It's been 2 days of thought processes that has resulted into meaningful and futuristic information. We are most grateful to you. I'm not conversant with the names, but let me start by saying that I thank the NTP managers, the government side, the 4 or 5 of you. You are so busy in your countries because we know the work that is on your desk. But you have been able to consider Africa, left those words, and came to us. May God bless you, and we are most grateful. Act Africa is grateful. I also thank the CESI partners, COPA, for taking time off your schedule and making sure COPA has achieved a lot during implementation. It's rather so sad that the project is coming to an end, but we are praying and hoping that something good will come out of it. Considering the enormous work and the quality of work you people have done. And I pray, I know, something good will come out of it. Let me also thank my CESI partners for the work that is done and continue to be done in their respective countries on the CESI project. All in all, we are brothers, we are sisters, we are people of the same paint, we stay in the same ship, so we need to work together, like Rachel said. Let's build win-win relationships. Let's build continuous learning relationship. If there's a program, let's think about each other. Let's know each other's strengths so we can pull each other along going forward in our next and future programs. So on this note, I will thank everybody for coming here. And I pray that God Almighty, who has brought us together and gave you traveling messages from wherever you came from, will send you back to your respective countries in good health, with increased knowledge,
Yes.
and also open doors
For more avenues for
us to meet. My good friend here, Andy, has been supportive to us. It's not because he's here. He has always been supportive and availed himself to us. And we need such good examples, and I can see that the room is full of such good examples. All of you, like I say, we're now in family. So let's not forget of each other when the need arises. It is a project you can look above your shoulder, you can look behind, oh, I have a brother who can fit in this area. They will pull each other together. That is how we can grow instead of working in silos. So on this note, thank you for coming, and I pray in the name of God we get back to our respective destinations safely. Thank you. At this point, on behalf of the team, I declare the 2 days training duly and officially
closed. When our politician.
If you want to go to the market, I'll be hanging around.
That's right.
To take you to the market.
Okay. So what time are we leaving?
Now. Now.
To the market.
To the market. To avoid traffic. So now, Francis, project our Facebook account, Instagram account. When you are uploading your photos, please tag Act Africa in all your photos. Tag us. Francis, upload put the account.
Thank you.
Okay, Rachel.
So can you say 440 or 4:30? I'll just be at the reception.
Okay.
440, yeah? Look.